Good afternoon. Good afternoon, and welcome to the Grinnell Prize Awards Ceremony and Symposium. Every year, we present the prize to leaders under age 40 from around the world who are doing the most innovative work in social entrepreneurship and social justice. When we created the program in 2010, our goal was to honor people who are modeling the Grinnellian ideal of learning in the service of social commitment. As the program has matured and thrived, I've come to see it as a powerful way to connect our students and community with exceptional young innovators. The winners teach classes and workshops, mentor students, and increasingly host internships that benefit both the organization and our students. It's a distinctive program and a way to extend Grinnell's distinguished history of educating individuals who are prepared in life and work to use their knowledge and their abilities to serve the common good. This chapel itself bears the signs of that history. One of the plaques in the back of the room honors Grinnell students who died fighting for the Union in the Civil War. Another honors the 11 abolitionist ministers who founded the college in 1846. Here at Grinnell, social commitment isn't just an idea. It's not even just a core value. It's an essence that courses through the body of our community. As I have noted at commencement, our school motto is Veritas et Humanitas, truth and humanity. For Grinnellians, these two principles are deeply intertwined. As proud as we are of providing a first-class education, this is not a place where we teach unbridled self-interest or sterile scholasticism. We believe learning derives its value only when married to a sense of social obligation, what we call the greater, more complex truth of being a caring, wise, and engaged individual. The Grinnell Prize has become a natural extension of this idea and a way to extend it even further. With this in mind, I'm pleased to introduce to you the winners of the 2014 Grinnell Prize. These four remarkable young innovators are just starting to make their mark. They were selected from among hundreds of nominations received from every corner of the globe, and they lead two remarkable organizations that have taken creative approaches to serious global challenges with impressive results. First, Kiah Williams and Adam Kircher are co-founders and directors of SIRUM. SIRUM stands for Supporting Initiatives to Redistribute Unused Medicine. With their colleague George Wang, Kiah and Adam created SIRUM out of a realization that America's health facilities were discarding more than $700 million in unused medications every year. Meanwhile, millions of Americans go without medications they urgently need but can't afford. SIRUM devised a system that bridges this gap, encouraging health facilities, suppliers, and pharmacies to easily donate their unused medication to safety net clinics. Some have called this brilliant idea the Match.com for unused medicine. But that description doesn't do justice to the tremendous impact Kiah and Adam's work could have on Americans' health. Throughout my own career at the CDC and NIH, I was involved in numerous studies that exposed the connections between health and socioeconomic status. Over decades, we've steadily accumulated evidence showing how in multiple ways your financial resources directly influence everything from your diet and exercise to your access to quality medical care to your ability to afford medicines. Kiah and Adam's ability to identify these inequities, analyze their structural causes, and then devise a way to disrupt conventional practices and improve health outcomes for low-income Americans is nothing short of impressive. Their work required them to master complex nuances of healthcare policy and health economics and technology, law, even supply chain management. As a result, they're now supplying medicine to as many as 20,000 Americans a year. In the process, they eliminated demand for new medications whose production would have generated 72 million tons of medical waste. For their innovative efforts to improve Americans' health, mitigate the serious consequences of poverty, and simultaneously reduce environmental harm, I'm pleased to award Kiah Williams and Adam Kircher the 2014 Grinnell Prize.
We wanted to thank Grinnell College immensely for this incredible award. We believe that healthcare access and equity is something that's important, and that healthcare is a basic human right. And we are thrilled to receive this award to help us continue to grow and scale our program and continue to reduce the number of people in this country who are skipping their prescription drugs due to cost. Thank you so much to Grinnell College for this amazing and incredible opportunity.
Now let us recognize our next two winners, Lindsay Stradley and Vallabhaneni, are co-founders of Sanergy. Sanergy designs and manufactures low-cost, high-quality porta toilets for use in the developing world under the name Fresh Life. The units are designed to be exceptionally easy to clean and maintain. They include hand-washing facilities and are small enough to be positioned at convenient distance from residential areas. This in itself would be a significant contribution to public health and sanitation in developing countries, where water contamination and diarrheal diseases are widespread. But Sanergy's true innovation is in their business model. Going beyond basic design innovations, they created a sophisticated network of local franchisees who purchase and independently operate the Fresh Life facilities across East Africa. Sanergy provides these operators with training, business advice, access to financing, and daily waste collection service. After collecting the waste, the organization is converted into organic fertilizer and renewable energy. Given that East Africa imports 1.2 million tons of synthetic fertilizer each year, the Sanergy model has the potential to significantly improve agricultural practices and reduce environmental impact. Here again, I'm struck as a physician and scientist by the imaginative approach our winners are taking to what seems like an intractable global health problem. Not only have Lindsay and Ani and their colleagues found a way to improve hygiene and deter the spread of disease, but their commitment to socially entrepreneurial approaches is also supporting financial independence and improving agriculture and the environment. Today, we honor Lindsay Stradley and Ani Vallabhaneni, co-founders of Sanergy with the 2014 Grinnell Prize for improving public health and contributing to financial independence and sustainable agriculture and energy practices across East Africa.
Good evening. Thank you on behalf of the more than 150 teammates that we have back in Nairobi. Lindsay and I are deeply honored and humbled to accept this award from Grinnell. The Grinnell Prize plays a unique role for us because it helps us continue our innovative work in sanitation and changing the face of sanitation in urban slums by not only highlighting the work that we do and bringing in additional talent and energy to it, but also providing us the funding to continue this work. Social change, whether it's in San Francisco where Kiah and Adam work or in Nairobi where we work, can often seem like a very lonely endeavor. And over the past couple of days, getting to know the entire Grinnell community that's so committed to social justice has been quite refreshing and inspiring. And to know that as we do this work, you guys are there to stand by us and keep us motivated and keep us going forward in this. And hopefully over the coming months and years, as we continue to build this relationship with Grinnell, you'll actually come and work with us in solving these global problems. Thank you so much.